Okay, this video is called Typical Patient Conversations, and it's really just memories I've had over the years of talking to lots and lots of patients and sort of what it's like. Because the audiences that watch these educational videos on the internet are very different than the typical patients that show up in a doctor's office, or lots of friends and families are sent to talk to me. And, typical patient that I'll end up talking to will be over 50 years of age. Usually people don't come for help when they're younger. Sometimes I talk to plenty of younger people, but the vast majority are over 50. They're usually fat, hypertensive, diabetic, hyperlipidemic. Typically they got obstructive sleep apnea, fatty liver, coronary artery disease, erectile dysfunction, gastroesophageal reflux disease, DJD, knees, hips, spine, cataracts, chronic kidney disease, cholelithiasis. They're usually on about 5 to 15 pills. This is just the typical person, okay? This is so generic. Any doctor, as soon as you say, 55-year-old, 60-year-old, they'll think all these things. Okay, and then, typical thing I say to them is, you might want to try to improve your diet. And typical patient will say something like, oh, no, doc, I eat well. And I'll say, well, lots of patients think they eat well, but they don't. I go, you have all the diseases that are typical of a person who eats poorly. Can you just tell me, what do you eat for your typical dinner? So the patient, lots of chicken and fish, and it kind of goes downhill from there. And so that's typical. All right, here's another patient. The guy's got, a couple coronary artery stents. He's had open heart surgery. He's got cancer. I say to him, you might want to try to improve your diet. He says, oh, no, doc, I eat well. I'm not sick because of diet. It's because of genetics. Everyone in my family is overweight and has heart disease. My sister just had open heart surgery. Me. Maybe that's because you all eat the same kinds of foods, meats and oils and sweets. Okay, next typical patient conversation. The guy's, fat, just had his toe amputated for diabetes. He's got cancer as well. I say to him, you might want to improve your diet. Oh, so now you want to take away my ice cream. Ice cream is one of my few joys in life. Name your favorite food. A bunch of different foods I'll hear that for, but ice cream is a typical one. Another patient, I'd rather die than stop eating meat, which is exactly what happens to those guys. The next one. This is a very common response I get when I bring up the subject of nutrition with these really sick patients. They give me a surprised, puzzled, disbelief look, like your wife acting when she doesn't want to pretend you're correct about something. And then also it's kind of like I'm being weird, or why am I talking nonsense or something. And it's kind of like a Hollingworth effect. So anyways, what I'm trying to say is most people are so clueless on the subject of nutrition that it's almost impossible to get them to change their diet. And unless they change their diet, they'll never get better. And the doctors are in a hurry. The way modern medicine works is doctors don't get any reward for quality of care. They get a reward, in a sense, for speed, for quantity. I can tell you, I knew a lady doctor, a friend of mine one time, and here's what she said to me. She said, practicing medicine is like selling hot dogs. You sell more hot dogs, you make more money. And what I'm trying to say is a doctor is rewarded if they go fast. Everybody in the healthcare system likes a doctor who goes as fast as possible with the patients because they get done with their work faster. They can help the other workers, the other doctors and workers get done with their work faster. So it's very much valued by the healthcare team. If they see more patients in a day, they generate more billing for wherever they work. One of the things I was very disappointed in as I got more experience in medicine was the realization that there's really no reward for excellence or for quality. As long as you meet the minimal standard of the standard of care, you're not going to get in trouble. Everybody's happy. And that's all you got to do. I got a lot of extra IQ left over beyond that. And I'd like to use it for something. And that's kind of how I started writing these books and making these YouTube videos. Because the human brain and personality gets satisfaction from trying to improve, trying to, be really good, excellent at something. So anyways, I just share it with you because a lot of times people say, oh, these doctors, how come they don't know anything about nutrition? They lazy, stupid, or jerks, or greedy, or something. And what I'm trying to say here with this point is it's almost impossible to talk to a lot of these patients. They're so clueless, it would take hours and hours to kind of get them with it at all about food and nutrition and health. And I really think if you made an outpatient clinic, kind of like what some of these telehealth places are nowadays, where all you did was bring people in and give them lectures all day, and then later on have question and answer sessions later in the day. And Dr. Esselstyn does that with his one-day course. Dr. McDougall, Chef AJ, and other places, they do this, through telehealth and whatnot. And I actually think that's where it's at. A good telehealth service of this type, or even an in-person setting like Dr. Kentner used to do, they will have the best results in the world for treatment of chronic disease, because you can't treat dietary diseases with medications and surgery. You can't treat them very well. So anyways, I just share this for what it's worth.